So I thought I present a case study for you guys today. This is going from failed injections to lasting relief. It's a case study on hip bursitis, and it's another possible solution to where some of the pain is coming from. And that's kind of what we're going to talk about because it's an area that no one looks at when someone has hip bursitis and they get an image, and we're going to go into all of that. So make sure you stay tuned to the end because we're going to show you some exercises that will definitely help if this is where some of the source is coming from. So a little bit about us. We are dedicated to helping you stay active and mobile without unnecessary surgeries and injections. We often see clients that have seen 5, 6, 7, 8, 9, 10 different types of healthcare providers without getting a solution. So when people have had all those failed treatment options, those are the typical clients that we see. We want to give you hope that it's possible that you can get your life back without having to go through some of these procedures that often don't work or just lead you down the path of having other issues. I mean, the less we can mess with the body, the better it's going to feel long term. So make sure you subscribe so that you can get some of our other great education and tips that we share. So this is the client's story. They were getting hip pain on the outside of that hip. They were having difficulty sitting, walking, sleeping. It was really annoying pain. And it didn't really stop them in their tracks, but it was just like there all the time. And it just gets to be wearing and exhausting when you have something that you don't know what you can do to kind of get you some relief. They started getting some hamstring issues as well, some upper hamstring issues, as well as some tight hip flexors. Those were all some of the symptoms that were happening at the same time. Of course, they went to the doctor. The doctor wanted to take a picture of it. They did do an MRI, which showed inflammation around the hip bursa, which is really common. But you have to get to why is that hip bursa inflamed? Otherwise, you're just treating the symptoms. So the first thing it says, like, let's just do an injection because you have inflammation. And so they did, and it did not work, which is very frustrating. So now you've spent all this money on MRIs and on hip injections, and you're just like, oh my God, this is not working. They tried massage. Massage didn't help. It just came right back again. They tried strengthening with physical therapy. It actually made them worse. They were trying to strengthen some of the muscles around the hip, and it actually was making them worse. Why? Why was this happening? So they definitely were frustrated. They were not sure what to do. By the time they came to us, I think we're like their 7th person that has actually looked at their hip. And they were a little skeptical at first because they weren't sure if, like, Lee, is this physical therapy going to be different? And so that's what we're going to kind of talk about, like what we found. So no one checks their back as a possible solution, as a possible source to their problem. And when you can have back issues, that is one of the sources that can refer pain into that hip. And you don't have to have a pinched nerve or anything to refer pain into the hip. Honestly, it's not the nerve that is being pinched. We have structures around the disc and around the spine that when those structures get irritated and damaged, it refers pain into that hip. And then what happens is that hip will tighten up and protect. And when that happens, that's when you will have that inflammation around that bursa because the hip muscles are so tight because the pain is being referred into the hip, tightening up those muscles. So that's just one of the sources that was the problem. And that's actually what the source of this particular person was having. And no one looked at her back. And so that's one of the things. Typically, when you have a pinched nerve, you're going to have pain down the leg. Pain in the hip doesn't mean that you've had anything happening to a pinched nerve. It's kind of like, I say if you had a scratch on your arm and it's really irritated, it can refer pain around that scratch. And when you start getting healing, that pain starts going more and more to the center of like where the issue really is. Same thing happens with the back. The scratch in the back is just referring pain down into that hip, and those hip muscles are tightening up. So here is the problem, with our healthcare system is that the hip were symptoms of something else that was going on. No one went and looked at the back. We even look into the thoracic spine because the thoracic spine also can create pain into that hip as well. So we've got to look at all these joints and how they move, because our first phase of treatment is always looking at mobility. How does the thoracic spine move? How does the back move? How does the hip move? If any of these things aren't moving, they can be problems, creating different symptoms. This particular person wasn't moving in her back. And as soon as we started treating her back, her pain in her hip started going away. We didn't even touch her hip. And so that's one of the things that we have to look at. And so I always say, where the site of the pain is often not where the source of the problem is located. So the injections were just treating a symptom. They often do. You have to go to like, why is it inflamed? Now, if your pain is constant, you can't, unrelenting, you can't move into a position to make it better and worse. Well, then injections and medications can be a step of the process. They're usually not the only step of the process, but they can be a step. But when it's just kind of a dull, you can kind of move and change your position and make it feel better, even if it's temporarily. Then these things, typically injections aren't going to work. Again, you have to get to the why. The hamstring tightness and the hip flexor tightness was a symptom. So when you get pain, then you start moving in different ways to combat that pain. And then all of a sudden your hip flexors start tightening, your hamstring starts taking over because you can't use some of the muscles that you need to be able to use because they're hurting. So you can have poor recruitment, you can have protection due to pain. All these things you have to go into, like, why is all this happening? You got to get to the source. Most people stretch and strengthen the lateral hip muscles, and that doesn't work. I mean, you've got to get to like, why are the muscles tight to begin with? And most of the time, even when the hip is an issue and that's where the source is coming from, we're not stretching those muscles. We're getting that joint mobility to improve better. But this particular case was coming from the back. We had to improve the back mobility in order to get things getting better. So this gets to be really frustrating because they want to get resolution, but nothing seems to be working. And again, no one checked her back as a possible solution. So these are common back pain referrals. So you can see how we can have issues in the lower spine here, and they can refer right into that hip. Then that hip can tighten up. That hip also can refer pain down the leg. So can the back. The back, if you go and you have a pinched nerve, that can refer down the leg. Again, we can figure out which level it is based on like where it is in the leg, but you can have tightness in the hip that refers down the leg that's created from tightness in the back. So the back pain tightens up that hip, which can tighten up other areas and refer other areas to part of the leg. So we've got to figure out where's the source. We've got to figure out the puzzle. And that's what we're really good at, because we move and retest baselines and move and retest baselines to give us information and education as to kind of what's going on in the body. So whether these baselines improve, get better, stay the same, it all gives us information as to what the next steps are. It's a very logical process, and we use a lot of critical thinking skills to go like, that doesn't make sense for this. That does make sense for this. And we're going to start working on this. And sometimes there's layers of things that we have to look at, because honestly, when people come in and they've tried so many different things, they've had chronic pain by the time they've gotten to see us, and there's layers of things that are going on. This particular case, once we resolved the back pain, they were doing pretty well. And then we could start working on some strengthening things to get them back up. So what do we do to start getting them some relief? So this particular client, we just said, let's roll up a towel. We're going to put put it underneath the lower part of the back. So roll up the towel and you're going to lie back over it. This is going to open up that spine to really kind of push the materials of the disc kind of away where they get damaged on those rings. So this helps improve that back mobility, which is what we're looking for. It also will stretch everything out in the front, getting some of those things to relax as well. But honestly, this particular exercise is really working on the back to really open up the back. When that opens up, a lot of the protection that happens will start going away. It's quite amazing. You can have muscles that are tight and protect, and then you open up the joint and then you go back to those same muscles and they're gone. Like you literally didn't even touch those muscles, and they're gone. And this is, again, one of the things when people go and get massages and their pain returns, that's a sign that there's something else that's going on. So at least you can start ruling some of those things out. If you have gotten a massage and it didn't work, it's just a step in the process going, okay, that's not it. Let me get to someone else that can figure this out. And so this is a great exercise. You can hold it for 2, 3, 4, 5 minutes. And I would say doing it 2 to 3 times a day. Again, rolling up a towel, put it underneath the lower back. You'll feel the stretch. If you don't, just move it down a little bit farther or move it up a little bit higher until you're like, oh, that's it. I can feel it. And it'll start opening things up. The other exercise that we gave, the hip was a little tight for this particular client, but a lot of it I think was coming from the back. So one of the next exercises that we gave her like the following week was just stretching out the hip. Now, what you're doing is you're basically kneeling down and you're moving the hip like you're stretching that hip flexor, but you are trying to go as far forward as possible because we're trying to almost get that front of that hip joint down to the ground. It doesn't go down to the ground, but that's the motion that we're trying to get, and just breathing and relaxing into that to really kind of open up that hip mobility. And so these are two of the stretches that we gave the client to really open things up to get the joints moving so that we could then start working on the next phase of treatment. So what else do you want to check? If this is a chronic issue, you may have to release some of the tightness, because if they've been tight for so long, you'll get shortening of those muscles. And so when everything's released, like everything is moving well, that shortening doesn't have the protection. Maybe you've had it for so long that those muscles have shortened. So you may have to release things like the hip flexor. You may have to release things like the deep hip rotators, but they've shortened. But that you get to those after you work on improving some of those mobility, because you see what's left over. And so you may have to work on some of those things. The other things you're going to have to work on would be poor movement patterns, getting the correct muscles to fire. Because if you've had these chronic issues, you've created these protective patterns that your body moves in, that your body's used to moving in, and you've got to undo some of those. It's kind of like if you've had, knee surgery and you've been limping on the knee, and then all of a sudden the knee doesn't hurt anymore, but you're still limping on it. And you're asking them, well, why are you limping? They're like, I'm not limping. I'm like, yes, you are. It's because that's their normal pattern. Even though they don't hurt anymore, that's the pattern that they're so used to being in. And we have to undo those patterns. So there's patterns in the hip and the back that we typically move into, and we've got to undo some of those patterns. We've got to look at what are the individual weaknesses that are there, putting everything together, and then getting back to feeling great again. So these are all the things that we look at when someone has hip bursitis that's coming from their back, and what we need to look at after we start resolving some of their back issues. So more great resources. We have a ton of resources. Go to our website, www.m as in Mary, power, power-pt.com. And we'll have a ton of blogs. Oh my gosh, we do blogs all the time. We have free reports on back pain, neck pain, knee pain, pelvic floor, TMJ, shoulder tips as well, testimonials, podcasts, our favorite like home equipment that we share with our clients all the time, where you can buy some of those things as well. Plus you'll learn how you can talk to one of our specialists for free if you live in the Dallas-Fort Worth area, so that we can start helping you on your journey to getting back to feeling great. And don't forget to subscribe to our YouTube channel, Empower Physical Therapy. That's where we are. Definitely subscribe to get more great tips.